Hello everyone, welcome back to another video. My name's Jared Beckwith. I'm a registered EEG technologist, and if you're not sure what that is, I put a bunch of wires on the patient's scalp and record their brain activity for the doctors. And in today's video, we're going to be talking about what does it look like on an EEG when the patient has a brain tumor. So let's come up with a hypothetical situation. So first, I'm just going to open up a normal EEG. And so for a hypothetical patient, let's say we have someone who has a brain tumor in the left occipital region. So the occipital region is in the back of the head, and that's the part of the brain that processes visual information. So if you have someone with a brain tumor in the left occipital region, they could be experiencing some vision problems on the right side. So if you're not familiar, the left side of your brain controls the right side of your body, essentially. So a left occipital brain tumor can cause problems in your vision on your right side. So let's say they have a little peripheral vision blindness. Now, I'm just going to open up a regular EEG. I would love to have had an EEG of someone with a brain tumor in the left occipital region, but since it's a made-up patient, I don't have one right now, so we'll just do with a normal EEG, and then I'll tell you what would look different if we were seeing this left occipital brain tumor. So in an EEG, you want to count the what is called posterior dominant rhythm. And to do that that's just a fancy way of counting how many waves per second in the back of the head. And in the back of the head is where this person's tumor is going to be in our fictional example. So first, let's count how many waves per second in the back of the head. So you got to find the O's for occipital. This is just our normal EEG here. There's our O's. So the right side of the head is even numbers. So O2 right here and here. Those are going to be the right side of the head. So let's go ahead and give it a count. How many waves per second? I just count the top of the waves. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And now we can compare that to the left side of the head, O1. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 9.5 to 10 hertz per second posterior dominant rhythm. And they're exactly the same on both sides. Now, if our person had a left occipital brain tumor, instead of counting 10 per second here in O1 area, left occipital side, O1, that's where you're going to want to look for the left occipital brain tumor. And instead of 10 waves per second, like in this normal EEG, we'd only count like 1, 2, 3, 4, maybe 5 per second. So there would be a lot less waves per second. The waves would be bigger and more slower on the left side where the tumor is. So this is a normal EEG, so you can compare it to, but in a person with a brain tumor, like we were talking about in our example earlier, in the left occipital region, look for O1, odd numbers for the left side. So O1, it would be only like 5 per second instead of this 10 in the normal EEG. So what happens when a person has a brain tumor on the EEG? It's called focal slowing. Focal means just in one area, and it's just slowing, which makes sense because if the normal posterior dominant rhythm in the back of the head is between 8 and 12 hertz, an alpha rhythm, you might be seeing some theta waves where the tumor is, and theta waves are slower than alpha waves. 4 to 7 hertz are a theta. So yeah, you'll probably be seeing some of that, and maybe even delta. So, but essentially slowing in one area. Now that is what you would see if you had a patient with a left occipital brain tumor. And if you have a history like this, you get an order for an EEG, you get your history, and you see that the MRI and the CAT scan have already been done, and you see left occipital brain tumor, before you even hook up the EEG, you should be knowing to look for left occipital slowing on the EEG. So and that's crazy because I've done stuff like this before where I would read the history and I would know exactly what the EEG would look like before I even put the wires on the head. That's when you know you've been starting to do a lot of patients and your skills are really paying off, guys. So this is an example that'll definitely be on the board exam if you're becoming a registered EEG technologist. So you're going to want to know if there's a brain tumor in one area, there's going to be focal slowing in one area. Instead of 10 hertz on each side, it's going to be asymmetric. The side with the tumor is going to be slower than the side without the tumor. Makes sense, right? Easy enough. So if you like this video, if you got something out of it, make sure you hit the like button. Really appreciate it, guys. I love you all. I will see you guys on the next video. Comment down below. What else would you like to see? I just thought I'd show you guys a nice little explanation on what it would look like if there was a brain tumor on an EEG. I wish I had a perfect EEG example to show, but using our imaginations, I think based on this normal EEG, we're able to imagine what an EEG with a brain tumor would look like. So thank you all for watching. I'll see you guys on the next video.